let me also mention something else with the indirect bonding. And I'm seeing a lot of patients come in with ADD, ADHD.
Oh, wow.
And so I'm working on writing a paper about that in terms of indirect bonding and kids with autism, special needs. How can they sit through a long hour appointment, repo appointments as well, to get braces on? And way it's so much easier, so much faster when they're just sitting there for 20 minutes, right? Time is valuable. Doctor time, patient time, everyone's time is valuable. And it's a lot more convenient for patients who are diagnosed with hyper ADD, ADHD.
That is totally true. And I've worked with a lot of special needs spectrum kids before, and there's a lot of different services. Actually, I find a lot of times that aligners and functional appliances can be better, you know? So positioners, I do a lot of work with positioners. They're just really like soft and comfortable. So, and that's a great way to differentiate your practice. So cool. Did you have anything else that you wanted to share, Doctor, or should we turn it over to our students for our attendees to ask questions?
Sure. I just wanted to mention, it's just really easy. If you feel like you have like a lot of staff time to make indirect bonding trays, it's not that hard. It's not that complicated. It's just very technique sensitive, and all the ingredients, all the steps has to be done in sequence and has to be followed to a T. Otherwise, there's so much room for error, which is really important. But we can teach your staff how to make these trays, how to make these setups, what the correct way of doing it. It's actually fun when I come home, come back to work the next day. I have a box of cases on my desk sitting there in a light box, light tight box, black box, with all the brackets set up, ready to go for the patients who are coming to get their braces on in the next few days. And all I have to do is I just have to tweak minor of where the brackets really need to go for a deep bite, open bite, and then put them back in, and my systems will cure them and make the trays. So in a way, it's kind of like set it and forget it. And it gives me time enough to check to make sure the case is actually going really well. We spend a lot of time on our clin checks to make sure brackets, and we never spend a lot of time on our braces patients to make sure this is where the bracket really needs to be before we put them on. So with indirect bonding, you actually like study the case and say, oh wow, I really need to flare these teeth, or I really want to flip the bracket backwards or upside down because I don't want too much torque. And this is all the stuff that you can do in advance and think about before the patient actually comes in.